That's sobering about people needing to eat, but Ravi, also people need to be cared for. So can you talk about on the medical side?
Absolutely. Alan covered a lot of what I wanted to say, so I'm not going to have much to say anymore. I chose the seat wisely. And, let me talk a little bit about what Alan ended with, or before he ended with, in terms of fundraising and the developed world. We've been using, for the past few years, we've been using e-newsletters, emails, no more posting letters, saving us a fortune in terms of stamps. I'm not sure USPS is happy with that. But over the past couple of years, we started using Facebook. Last year, we started using Twitter. And we're using it to not just to inform people of what's going on and the needs, and to advocate for some of the needs of the people that we are seeing on the ground, but also we're using it to inform our supporters, our volunteers, our staff, and our donors as well, and tell them what's going on the ground, what are the needs, who's doing what. And people need to connect. People, when they donate money, they want to know what's going on, what's happening to to their money. And we're using this very strategically to inform people so they would know that their money is well spent. And in cases where the money is not spent, we say we couldn't go to this area because of security. And also, Haiti proved to be a particular case where we used technology to an extent where we didn't think we could use it in Haiti. As I mentioned, we deployed to Haiti and we were on the ground in 22 hours after the earthquake. We were not in Haiti before the earthquake. And frankly, we didn't know how we were going to communicate with our staff there. BlackBerry was the only thing that worked in Haiti in the early days. Text messages and BlackBerry Messenger. And I hope there's someone here from BlackBerry who would cut us a check for advertising for them. But it was amazing that we were in touch with our staff, as well as the staff were in touch with each other. And this has tremendous implications, not just in terms of needs assessment and what's going on and where the destruction is and what hospital is functioning, but also in terms of the security and safety of our staff. When they go into an area that they're not familiar with, this is something that we really worry about. But also, blogging became also a tool where people from the field, they will blog about their experience. Within 2 weeks, we had about 65 physicians from the US on the ground in Haiti working out of the largest hospital in Port-au-Prince. And every evening, they'll go back and blog and send emails to their families. And that helped spread the word as well in terms of what's going on, what are they going through. But also, it helped them get things off their chest. They saw it as an avenue to talk about their experience because they didn't have anyone to talk to. Now, that's the good side of things. On the other hand, there are certain countries where we work where there's absolutely nothing. No cell phones, no internet, forget about internet. The mountains of Afghanistan, we still send messengers on mules with letters to deliver the messages that we want to deliver, or the money. And that takes a while. So we have to also be realistic in terms of the expectation and the impact of technology in what countries and the impact that it could have or it wouldn't have. In certain countries, there are no x-rays, there are no labs. And if we're lucky to have an x-ray, usually there's no light. So we take the x-ray and, take it outside, point towards the sun and try to read the x-ray. Cell phone technology is something that's really, I think it's underestimated, the use of cell phone technology. And we'll talk about medical use. In a lot of the places where we work, there's no internet. Cell phones work. And we're using cell phones for data collection for health information systems, where we teach normal people who are not doctors or nurses, community health workers. We tell them, if you see a case of diarrhea, dial 1. If you see a case of measles, dial 2. And all of that comes into one hub that we analyze it and we share it with the Ministry of Health to predict any outbreak of disease. And this has been really a tremendous tool that we've been using for the past few years. One thing that Alan mentioned, in an emergency, coordination is really critical. And sometimes there are way too many coordination meetings. I call it death by coordination. If you look at Haiti, we were in tents. It was about 100 degrees in a tent with 250, 300 agencies present in that tent. And there wasn't much coordination. Let's be realistic. 300 people talking at the same time, you're not going to coordinate anything. You're just sharing information. And technology, if it's used widely, it could solve that problem. There were a couple of technological platforms that we used for information sharing. OneResponse was one of them, where people would upload their information And that helped a lot in terms of knowing who's doing what and who has a pediatrician, who has an orthopedic surgeon, what are the needs across the board, who's got medicine that we didn't know. WHO had morphine, the World Health Organization, and we desperately needed morphine. We broke into their warehouse because we knew they had morphine and we couldn't find anywhere. We broke into their warehouse and we got the morphine because we were amputating people without any morphine. But the technology could actually help a lot in that aspect, where actually the meetings will become a coordination meeting rather than everybody singing their own praises about what they're doing. And it will reduce the number of meetings, which will increase the efficiency of staff. They'll spend their time actually working instead of coordinating. One more thing. I think, no matter where technology takes us, it's the people that use that technology and what they use it for. There are a lot of tools out there. They're competing tools. They're competing companies for technology, for satellite imagery, for information. But at the end of the day, it's the people that are behind it. We shouldn't be slaves to those tools. The tools should work for us, not us working for the tools. And over the past couple of years, we've seen a lot of efforts from people who were working actually for those tools rather than the other way around. And that's an absolute waste of resources and energy.
Just to pick up on the point you made about the cell phone and transparency and blogging and the ability of every individual to become a publisher in many ways. And I was reminded of a story about UPS, who I think was here earlier this morning and talked about in Haiti. A lot of the blogosphere caught on to the fact that it was impossible to get aid into Haiti. And it raised their ire, obviously, because there was so much transparency and awareness of the issue. And they directed that ire at private sector companies, in this case, logistics companies like UPS. UPS, to their credit, had their ear to the blogosphere, and despite the fact that they were in no way in the wrong, they quickly reacted to that and jumped on the effort to help Haiti, which is an introduction to Bill, some comments that I think you're going to make about how the private sector is getting involved, how business is getting involved, and whether wittingly or unwittingly in this process.